Asthma is known as tamak shwas in Ayurveda. When we talk about asthma, due to the rise in pollution level around the globe, today the cases of asthma are on a high rise. In all parts of the globe, we can find out patients of asthma. The basic reason, underlying cause in asthma can be various, the most common being allergic asthma. We won't go in the details of various kinds of asthma right now because it is the Ayurvedic aspect of asthma and the treatment concept of asthma that we are going to focus over here. In asthma, in any kind of asthma, the elasticity of alveoli of lungs is severely hampered, maybe due to any underlying reason. So it is basically the elasticity of Shwas Vahi Srotas that we work on. That is, we improve the elasticity of alveoli with the help of our Ayurvedic herbal combinations. As the patient continues with these combinations, slowly and gradually the elasticity goes on increasing, which decreases the severity as well as the frequency of attacks of asthma in an asthma patient. Now there is a very common question that arises in the mind of each and everyone. That question is that how come if a patient is allergic to a particular thing, Ayurveda, can it get rid of those allergies? The simple answer to that is Ayurveda increases the threshold to that allergy. That means that supposingly a person is having dust allergy, for example, and the threshold is so less that with a little bit of dust the allergy precipitates and the patient has an attack of asthma. Once the patient gets our course of treatment, the threshold of that dust increases so many folds that even with the severest kind of dust, the patient does not get that allergic manifestation. So that is how we work on allergies. The medications which we provide in asthma patients are very convenient to take. They include tablets, certain medicines to be taken with honey, certain inhalation medications. That's it. As the treatment continues, the dosage of medicine also goes on decreasing. If the patient is already on inhalers, which is the general line of treatment in asthma patient, or even if the patient is on rotahalers, slowly and gradually we decrease the dependence of the patient on those inhalers or on those rotahalers. And in a course of few months, if the patient follows the do's and don'ts that we guide, along with the yogic pranayams that we guide, the patient can lead an asthma-free life forever.